The next category of medication that we're going to look at as an oral hypoglycemic is a category called the alpha glucosidase inhibitors. And of course, glucosidase, ASE, that tells us that there's an enzyme involved. So it inhibits an enzyme called alpha glucosidase. These drugs are discussed on page 315 as well, under the insulin sensitizers. And our prototype drug is acarbose, and you see that as the first one listed, and it can go by Prandase or Precose. Prandase or Precose. And this works to inhibit enzymes that break down starches. We've got all these enzymes in our intestinal tract, and as carbohydrates and glucose that are more complex get into the GI tract, this alpha glucosidase breaks those down into glucose and absorbs it into the system. And so this particular drug just tries to stop that glucose or that enzyme from working so quickly. So starches and sugars are going to break down more slowly. Now, of course, because it's working in the GI tract, we can expect to see side effects in the GI tract. Diarrhea, bloating and gas formation, a little bit socially difficult. If somebody has an existing bowel inflammation like Crohn's disease, irritable bowel syndrome, this might make it worse. So people with existing GI problems are really not a good candidate for the alpha glucosidase inhibitors. The other type of drug, miglatol, you give it with the first bite of a meal, but truly that's pretty much all of these. Like take a bite and then take your miglatol, but I think that's true of all these oral hypoglycemic drugs. Remember that the name alpha glucosidase inhibitor tells us that there's an enzyme involved. So should you have to answer a question about, the action of this drug, you see that it prevents this enzyme from breaking down carbohydrates and sugars. Other diabetes drugs don't interact really well with these, or might not react well with these drugs. And of course, what side effect are you going to see? That's right, hypoglycemia. On page 316, we've got some nursing implications and some patient teaching. And of course, you want to tell the person to avoid alcohol. And like any PO drug, watch for allergic reactions. So you can see we kind of have a theme going with these drugs. Watch for hypoglycemia, watch for allergic reactions, take with the first bite of a meal. Just learn the actions. Does it work in the GI tract? Does it work in the liver? Does it work in the pancreas? This is a very new and very promising category of drugs for type 2 diabetics. These drugs are called the incretin mimetics. Now, incretins are hormones that the GI tract releases after a person has eaten. And as scientists have studied type 2 diabetes through the years, because of course they have, to help us develop all these new meds and make lots of money for the pharmaceutical companies. One of the interesting observations that was made was that these incretin hormones do not seem to be as abundant in type 2 diabetics as there are in people who do not have type 2 diabetes. So that was something that was found. And so oddly enough, this first drug, this prototype drug, exenatide or Byetta, was discovered because of a creature in the desert. You've probably heard of the Gila monster, Gila. It's a reptile that's found in the southwestern United States and Mexico. And it's an ugly little thing. And it will bite you if you bother it. It's not something you'd bring home and put in a fish tank like, a bearded dragon or something. They're not real friendly. And they will bite you. And it was noticed that after the bite of a Gila monster, people's blood sugars would really drop. And when their saliva was studied, it was found that they isolated a whole bunch of these incretin hormones in the saliva of this particular reptile. So they started studying it, trying to figure out how they could use that to their advantage. And so, as with anything animal related, you look at the components of the particular substance, you reproduce them in a lab, see if you can make them synthetically, and voila, you might have a new med. So incretins work in all kinds of ways, more than one way. They do all the good things. So one thing they really do is try to increase insulin secretion. In fact, it even has been found that they can increase the amount of beta cells in the person's pancreas. They decrease insulin sensitivity. They decrease or they increase insulin secretion, they increase insulin sensitivity, and decrease glucagon secretion, which affects the liver. Generally, they're going to suppress the appetite. They're going to make a person feel fuller sooner. They slow down the amount of gastric emptying that takes place in the stomach, so you feel full longer. And if you are not emptying things as quickly, you don't have you slow down the amount of insulin that is needed right off the bat, so the body can kind of respond more normally. It's thought to protect beta cells from inflammatory injury. So it does a lot of really, really good things. In fact, this drug has just recently been approved as a weight loss medication. It's a sub-Q injection. For diabetics, they take it usually once a week. For weight loss, I think you take smaller amounts every day. But because it suppresses the appetite and makes you feel fuller longer, it could be a valuable diet aid. I've heard people who take it say that you also have some GI discomfort and some nausea and diarrhea at first, and so that also could contribute to lack of appetite. Expected side effects, you see GI stuff. You might have some upper respiratory tract symptoms for some strange reason, and possible allergic reactions. These drugs don't interact well with certain herbal products and other oral hypoglycemics. And you can imagine, of course, hypoglycemia. Because this can have an effect on the pancreas, you want to watch for signs and symptoms of acute inflammation or infection in the pancreas. Like I said, these are given sub-Q, and you would inject 60 minutes before a meal. So when you take it, you're not going to take it in the old time. You want to make sure you take it about an hour before you eat.